Dear student, Model 30, Inherited Immunodeficiency. The main objectives of this episode are to study the concept of immunodeficiency, to know the types of immunodeficiency, to understand the genetics of B cells and T cell deficiency, to explain the diseases caused due to the immune defects, and to know about the possible diagnosis and treatment for the immunodeficiency diseases. Introduction. The main protecting wall against all pathogens and the infections is our immune system. When an immune response is absent, then our body cannot fight against those pathogens. The defects in the immune cells and other complement system results in the immunodeficiency. There can be defects in the maturation of cells of the immune system, poor functioning or any genetic defects lead to the deficiency in total functioning of the immune system. Mainly, immunodeficiency is the group of disease which alters both innate and adaptive immunity. It is classified as a primary immunodeficiency and secondary immunodeficiency. Primary immunodeficiency is more likely genetic and inheritable. Secondary immunodeficiency is acquired and caused by external factors. Hence, this episode further explained in the following headings: A. Inherited immunodeficiency, B. Primary immunodeficiency, C. B cells and T cells deficiency, D. Secondary immunodeficiency, E. Diagnosis and treatments for immunodeficiency disease. A. Inherited immunodeficiency. Malnutrition is the common cause for the immunodeficiency. Any genetic defects in the development or functioning of the cell can lead to many recessive diseases. Immunodeficiency is heritable. It mainly inherited in autosomal recessive and X-linked recessive manner. The gene defects lead to the absence of immune response can be studied, and the molecular level of immune pathways can be examined. They can provide the necessary guidelines and treatment. In the case of inherited immune defects, the susceptibility to infection is more often during the infant stage. Most of the immune defect diseases inherited in a recessive pattern. The gene mutation takes place in the X chromosome. The immunodeficiency can be seen when both the copies of the X chromosome show the defective gene in case of recessive conditions. Males having only one X chromosome have higher chances of getting these immunodeficiency diseases. Females carry two X chromosomes, and in case of the recessive condition, they will not show the immunodeficiency symptoms. Instead, they act as carriers. there can be a defect in the development of B and T cells, surface molecules which are responsible for the activation of the immune response, defects in other cells like phagocyte cells and complement system. Currently, immunodeficiency is considered as one of the critical case study to learn about the molecular level of pathways of immune system. The immunodeficiency disorders can also develop by some drugs or some chronic disorders. There is some possibility that individual with an immunodeficiency disorder will get some autoimmune diseases. Autoimmune diseases result in the destruction of their body tissues by the immune system. The immune system will keep the individual healthy, young and active. Naturally, as the age increases, the immune system will start to deplete. B. Primary immunodeficiency, PID. This is the intrinsic defect in the immune system, that is, the cells of the immune system. Defect in the normal functioning of the cells leads to diseases. Primary immunodeficiency disorders generally occur at birth. Some of the diseases are not able to recognize at an early age. These disorders will be genetic and are inheritable. These disorders are very rare. Primary immunodeficiency includes specific and non-specific immunodeficiency. Specific immunodeficiency includes the defects in the cells of the adaptive immune system. It consists of the abnormalities in the functioning of B and T cells. Non-specific immunodeficiency is the abnormalities in the functioning of complement system or phagocytes, which are the components of non-specific innate immunity. Primary immunodeficiency is genetically determined and individuals are more susceptible to infections. Individuals with defects in the complement proteins, phagocytes and immunoglobulins are more vulnerable for the infections by encapsulated bacteria called pyogenic or pus-forming diseases. Primary immunodeficiency is also known as congenital immunodeficiency, where the susceptibility to infectious disease occur from childhood. The immunodeficiency syndromes are grouped based on the parts that are affected in the immune system. Defects in the complement system. Complement system plays a critical role in the immune response, in which C3 component protein plays a central role as the opsonine molecule, where it helps in the destruction of the bacteria by the phagocytosis process. There are many other complement proteins. Together they form the membrane attack complex to destroy the membrane of infectious pathogens. Defects in the phagocytic cells. Phagocytes are significant for the immune responses. During the infection, neutrophils and monocytes present in the bloodstream will move towards the affected area. They include many steps of the pathway to reach the infected tissue from the bloodstream. These cells regularly move by adhering to the wall of blood capillaries by the help of cell adhesion molecules. They keep rolling through the blood capillary wall and by the process of extravasations. These leukocyte cells will move from blood capillary to the surrounding tissue. Treatment for the primary immunodeficiency include stem cell therapies, antibiotic treatment and antibody infusions. Some of the examples for the primary immunodeficiency disorders are combined immunodeficiency disease, hypogammaglobulinemia, congenital agammaglobulinemia, Job syndrome, Bruton's disease, Wiskott-Aldrich syndrome, etc. C. B cell and T cell deficiency. Deficiency in B cells. Individuals who have defects in the function of B cells are susceptible to pyogenic infections. Pyogenic infections can be caused by encapsulated bacteria like Haemophilus influenza, Streptococcus pneumonia and Staphylococcus aureus. Usually, these capsulated bacteria will not be recognized by the receptors on the phagocytes. Hence, they can easily escape the primary innate response. In the case of healthy people, the complement proteins and the antibodies play an essential role. They coat these bacteria and kill them by opsonization. Phagocytes can easily recognize and kill them. In case of deficiency, there will not be any production of antibodies and other essential molecules to recognize those bacteria. Hence, these bacteria can easily escape and remain as an extracellular pathogen. Some of the primary B cell deficiency include X-linked agammaglobulinemia XLA, IgA deficiency, immunodeficiency with increased IgM, common variable immunodeficiency is also called as CVID. 1. X-linked agammaglobulinemia XLA. There will not be early maturation of B cells. B cells fail to develop correctly and activate. XLA is inherited in X-linked recessive pattern. Males with only one copy of the X chromosomes are more affected. Females with two copies of X chromosomes act as the carrier for this disease. Affected individuals show very low or no B cells with the absence of immunoglobulins in the serum except little quantity of IgG. The mother can transfer IgG through the placenta, and when the doses of IgG get reduced, the affected male gets more prone to pyogenic infections. The gene affected is Bruton's tyrosine kinase BTK, which encodes for the protein called tyrosine kinase. They belong to the family called TEC kinases. There are many other genes present on this long arm on X chromosome responsible for many other X-linked immunodeficiency disorders. This gene is essential for the maturation of B cells. The bone marrow of the affected male shows the normal amount of immature B cells. Mutation in BTK result in no maturation of B cells and no antibody production. Hence, the affected male cannot produce enough B cells or antibodies for the immune response. The affected individual may show some of the following symptoms: small lymph nodes, absence of tonsils, middle ear infection, sinusitis, pneumonia, skin infections, respiratory tract infections, and eye infections. In the treatment process, the person is tested for the number of B cells or other immune cells. The samples for the medical test are collected from the individual. Since it is an X-linked disorder, the doctors can check for the family history and can determine the risk factor for this disorder. Affected individuals can be provided with large doses of gamma globins in this particular disorder. Because of the failure in the maturation of the B cells, they cannot develop to form the plasma cells and produce the antibodies. 2. Deficiency in IgA and IgG. It is a common disease which can lead to other complex diseases. Failure in the B cell differentiation results in the no production of immunoglobulins. 3. Immunodeficiency with increased IgM. This results in the deficiency of IgA and IgG. The IgM is a polyclonal antibody which shows its higher production in this disease. Individuals are more susceptible to polygenic infections. 4. Common variable immunodeficiency CVID. This shows the defects in the T cells. T cells will fail to give the signals to the B cells. In this case, both females and males are equally affected. This deficiency can lead to some infections by viruses. Usually, CVID is not inheritable. Instead, they are in association with other deficiency. Deficiency in T cells. individuals with the defect in the T cell functions are susceptible to many infectious diseases. For example, severe combined immunodeficiency, which is also called as SCID, SCID. The SCID occurs in early life due to defects in the cell mediated immunity. X-linked SCID is the most prevalent form of SCID where a T cell fails to develop. Mutations in some cytokine receptors lead to the failure of T cell development. Another common form is autosomally inherited SCID caused by the deficiency in adenosine deaminase ADA or purine nucleotide phosphorylase PNP. In this case, there is no purine nucleotide destruction occur. Hence, all the nucleotide metabolites will start to deposit inside the cell and affects lymphocyte proliferation. D. Secondary immunodeficiency SID. The immune system gets affected by the external components such as viruses, chemicals and malnutrition. It can lead to some dysregulations in the proliferation of lymphocytes, autoimmune diseases and cancer. Secondary immunodeficiency disorders will occur late stages of life and the diseases are common than the primary immunodeficiency disorders. Some of the chronic disorders like diabetes or cancer will lead to the development of secondary immunodeficiency disorders. The drugs can alter the immune functions. Some are called immunomodulatory drugs and they can affect immune functions. Some elements like zinc, iron and selenium as well as vitamins like A, B6 and C are essential for the immune responses. E. Diagnosis and treatment for the immunodeficiency diseases. Immune disorders can be diagnosed by the medical histories, physical examinations and symptoms. Generally, individuals with immunodeficiency disorders show many infections. These infections can be unusual and can be demonstrated by the family members too. Physical examinations of the case is more important to find the symptoms. Sometimes physical examination can also give them information about the type of immunodeficiency. The disorders can also be determined by the age of the individual and type of infection they get. The individuals are asked for the family history, which gives an essential role in finding the immunodeficiency disorders. Blood cell counts. The total blood count abnormalities in the different cell functions will give a clue for deficiency disorders for the whole blood counts. The individual blood sample is collected and the amounts of total blood cells which are essential for immune response are examined. Along with the cell counts, the quantities of immunoglobulin produced are also tested. The white blood cell counts can be tested to see the number of immune cells. Mainly, T cell counts can be conducted and other immunoglobulin levels determined by some other test. Vaccines are available where they can use in many tests of the immune response called the antibody test. Doctors will check the response of the immune system to the vaccines provided after a few days. Sometimes genetic testing helps in finding the immunodeficiency disorder. If there are gene mutation result in many diseases, genetic testing is conducted to check the immune system. Genetic testing can be done by collecting the samples like blood, amniotic fluid, etc. In the case of some diseases like X-linked agammaglobulinemia and SCID, the amniotic fluid present around the fetus is collected and tested. This will give help if there is any family history of having immunodeficiency disorders. As the treatment process, antibiotics and immunoglobulin therapies are conducted. For the viruses causing severe infections, antiviral drugs are supplemented. Some such drugs are amantadine and acyclovir. Some other drugs called interferon are provided for viral infections. Bone marrow transplantations and gene therapy are the latest treatment used for genetic defects. Bone marrow transplantations can be done to correct the defects in lymphocytes in the case of SCID. Gene therapies can be conducted in case of some defected genes where the correct therapeutic genes replace them. Highly active antiretroviral therapy HAART controls HIV infections and play an essential role. This therapy helps in the increase in CD4 cell counts. HAART therapy includes the combination of components like 2 non-nucleoside reverse transcriptase inhibitors, NNRTIs, and an NNRTI or protease inhibitors. They help in reducing the chances of getting the opportunistic infections. To conclude, the immunodeficiency can be prevented in case of secondary diseases. Maintaining good health habits are essential to avoid chances of occurrence of immunodeficiency diseases. Thank you.